I think the biggest thing is actually culture and religion, because people who have been raised in very religious, conservative households, regardless of the religion, tend to be very closed off to the idea of pelvic floor physiotherapy, even if they're symptomatic. But that's the beauty of, like, I offer virtual physiotherapy, so I never have to put my hands on you, and we can discuss your symptoms, talk about exercises and strategies, and you can experience a huge change in your symptoms. So I feel like that's kind of like a way for people who are very sensitive or tentative about it, for them to access support without needing to lay down on a table spread open, right?
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify, so other people like you can benefit from our content.
Hello everyone, my name is Purva, and today you'll join me in my conversation with Surabhi Veitch, also known as the Passionate Physio, an experienced pelvic and orthopedic physiotherapist, pregnancy and postpartum fitness coach, and a mom of two. Surabhi specializes in supporting people through pregnancy, postpartum, and perimenopause, and her passion for women's health is evident in the multiple ways that she provides the support to her clients, followers, and fellow physiotherapists. She uses her platform on Instagram @ThePassionatePhysio and her podcast to educate and empower women to advocate for themselves and to become experts in their own body and pelvic health. Welcome to the Public Health Insight Podcast.
Thank you so much for having me, Purva. I'm so excited to be here.
Me too. You've got an undergrad in kinesiology and then a master's in physical therapy and then a master's in clinical science. Absolutely amazing. You're like superwoman. You're amazingly educated and everything, but has women's health always been a major interest for you since the beginning, or what did that career path look like coming into that?
So women's health specifically was not an interest. I think it wasn't until I became a mom that I really understood that so many of the healthcare deficiencies were not just because of chance, it was because I was also a female experiencing healthcare. And if I had come as a male with the same concerns, they would not be dismissed. If I had come from the perspective of a white male specifically, I would definitely not be dismissed. So I feel like motherhood was the big eye-opener for me, because that was something unique, right? Like, I was experiencing pregnancy. It wasn't just gut issues or acne or whatever else. It was specific to the fact that I was experiencing this pregnancy and postpartum journey. It's just so many issues are dismissed or like normalized, right? Where, you're just leaking. Well, what do you expect? Oh, you have core weakness. Well, you have back pain. Well, that's what it's like to just be a mom. And it's not just healthcare professionals that tell you that. It is other mothers, grandmothers, dads. Like, they just think it's normal, because what they are used to seeing is women complaining about their pain, women complaining about this hurts, that hurts, I can't jump anymore because I'm peeing myself. And I was like, no, that's not okay. And I started to piece together, just through both what I had experienced and how the healthcare system, it has such a deep bias towards women's health, that we actually consider women's health a specialized population rather than just 50% of the regular population. And just like we don't need to consider men's health as a separate topic. I mean, there are men's health initiatives now, but everybody can treat men's health, but only specialized people can treat women's health. And that is a problem, because every single healthcare professional is coming across females or people with female body parts in their careers, in their work. So why are only some healthcare professionals going further and receiving specialized education on women's health? And so as a patient, like coming from a patient's perspective, it's important to ask your practitioner those questions to see what is their training, what is their background, and stop assuming that just because they're a doctor or a physiotherapist or dentist or whoever, they're experienced in treating people like you. And women are very common, again, 50% of the population, but still a lot of people don't have the expertise to treat women. So.
Yeah, no, absolutely. And I think when we live through a specific experience, you said with motherhood, I feel like it's generally a lived experience for us, but we don't realize how normalized we make it for ourselves until we go through a more extreme version where we don't get that support. So was the focus on pelvic and orthopedic physiotherapy something that came about after also, you went through motherhood and pregnancy and all of that, or was that a interest that you've specialized throughout schooling?
So orthopedics, my actual interest in physiotherapy was to work with spinal cord injury clients, because when I was in high school, we did this amazing field trip to Lyndhurst Hospital, which is part of Toronto Rehab Hospital, where we got to see how physiotherapists help people with spinal cord injuries regain function to the best ability that they have. And I was like, this is amazing. Like, what a valuable career to have, and like how enriching, and what a big impact you can make in people's lives. Then when I actually got to physiotherapy school, I was like less interested in the neurological conditions and more interested in orthopedics. I'm athletic. I enjoy sports, dance, activities, and I've experienced both my own share of injuries, and I've also just been with people who've had many injuries, friends, family, fellow athletes on teams, and that kind of thing. And so it was really exciting to be able to, someone's knees hurt, you do a few treatments on them, and then they can get back to playing soccer or rock climbing or whatever it is that they want to do. I actually worked in orthopedics and sports medicine and workplace injuries, motor vehicle accidents for the first 10 years of my career.
Oh, wow.
Almost 10 years. And then I got into women's health after I had my daughter, who's now 6. I was always interested in pelvic health because I was like, hey, this is such a unique area of physiotherapy that we didn't learn about at all in physiotherapy school. Like, we had one lecture on pregnancy, and that was 1 hour long. And you can imagine, let's say 50% of the population are female, how many of them are going to have a baby at some point? Maybe 80%. Like, I'm just around that. That's a lot of people. But we don't learn anything about pregnancy-related pain, injuries. And a lot of moms, I would notice, would go from like being athletic to then having kids and then just stopping. And I'm like, your life doesn't end when you're 35 or whenever you choose to have a child. You still have however many years of your life left that you want to be active for, that you want to be not just for your kids, but for your own sake. And so for me, I had gone through pelvic health physiotherapy. It was helpful to a certain extent, but I felt like there was something missing. Like, I was just treated like a standard mom. I'm like, I'm not a standard mom. I'm me. I'm Surabhi. I have specific interests that are not the same as every single mom. Every mom is like that. Every person is unique. And I find that a lot in healthcare, we're treated as problems versus as people. So it's like, my problem is leakage. My problem is pelvic organ prolapse. So I was treated as every prolapse patient rather than me specifically. And so in my work with people, I really try to get to know the person in front of me rather than just what their problems are. Because it's very easy to treat the problem. It's much harder to treat the person, right? And so, yeah, my interest in pelvic health kind of sprang about more after I had kids. And now I marry the two. I do orthopedics and pelvic, because you can't really isolate one area of your body from the rest, because when one area of your body's impacted, the rest of your functioning is impacted. And again, that's, I feel like, a bit unique in physiotherapy, because many people either do one or the other. And so the 2 masters I have is all like orthopedics based. It's not until after that I was like, okay, maybe I'm interested in pelvic health. And it's funny because I'm Indian and Canadian. And so at first it put me off treating pelvic health, because I was like, I don't want to stick my finger up people's vaginas all day. Like, I literally thought that. I was like, that's so weird. And then I started to realize that was strictly because of my very like conservative upbringing, thinking that was weird, when I'm like, people stick their hands in people's mouths all day, like dentists. And what difference does it make? It's a body part.
And you're providing care.
And I'm providing life-changing care for people who have pelvic floor injuries. And so as a healthcare practitioner, we also have biases and ways we were raised and like things that we have to unpack. So it's really made me grow as a person and as a practitioner, because I've had to unlearn many of those biases that I grew up with that I didn't even know I had until I started to go down this route.
Absolutely. And I feel like pelvic floor therapy is something I've only recently learned about. I'd say the last like 5-6 years. I've also always been interested in women's health and reproductive health, but doing things like Kegels on the regular basis and all that type of stuff, I feel like it's only become more general popular knowledge in the last like few years, at least to the more common public who don't necessarily engage in that. And I know I've gotten my mom like trying to do Kegels because she's had issues with like pelvic floor, and she didn't like have anyone tell her otherwise for years. And it was really after menopause that the doctor was like, oh yeah, you have prolapse issues. And she was like, I have no idea what you mean.
Yes.
And so she had no idea, and it was actually causing so many like issues for her health wise. I have a family friend who had pelvic based injury while she was pregnant, and I don't think she received like that physiotherapy care through her pregnancy, and after giving birth she's had like a lifelong issue with it now. And so it's really great the work you honestly do, and I'm curious as to what you think is, you know, like people don't necessarily think that physiotherapy goes hand in hand with women's health as obviously as we're talking about it.
Yeah.
Otherwise, they think like, oh, I hurt my back or my knee hurts, I'll go get physio. They don't think about for pelvic floor or for postpartum or anything like that. What's the connection that you think is missing for the general public? And what is that connection that needs to kind of be more visibly seen?
So I think there's a few things. I think the public is very trusting of healthcare, and they're also naive on purpose. Like, we're ignorant to the fact as the general public that research is often done on white males that are fairly young, and that if you are not one of those people, research has not been done on you. So you go in for back pain and you're like, I just want a regular orthopedic physio. And again, our society has a bias towards assuming men are better educated, that they're better at their jobs. And even though largely physiotherapists are females, there's often a better trust of males, especially in like our cultures, right? Males as seen as more superior, as more brilliant, whatever, which is not true, but people have that belief. And so what ends up happening is I want the general public to know, when you go to see somebody who is working with you, you cannot assume that they know how to support you, because back pain in a 25-year-old female is very different than a back pain in a 25-year-old male. We know that pain has many sources, and physical sources are just one. There's also mental, emotional sources of pain, as well as, you could argue, spiritual sources of pain as well, and intergenerational sources of pain. And if you don't actually understand all the influences into a person's life, you're just treating mechanical back pain the way you would treat, again, a young white male. If you're a 6-year-old female, doesn't matter. And so a lot of people are like, I feel weird about pelvic floor physio, because they think that the whole session is me sticking my fingers up their body. I'm like, we don't even have to do an internal examination, because the pelvis also covers the lower back. It also covers the hips. So any menopausal, postmenopausal person with back pain, hip pain, knee pain, injuries, they don't understand how pelvic floor physiotherapy, especially with somebody who has that expertise and balance of pelvic and orthopedic physio, can really, really be helpful. So I think we need to take a little bit more initiative and stop putting our healthcare in the hands of others, because ultimately you are the expert of your own body. You live in it 24 hours a day, your entire life. Who else would know it better? And so spending 5 minutes with your doctor for them to diagnose you, in quotations, with arthritis, I'm sorry, that's BS, right? Even if they send you for an x-ray and the x-ray shows you have XYZ condition, the x-ray is not always the cause of your pain or injury. So spend your money and time with somebody who's actually going to spend time getting to know you, asking you about your history, asking you about when it started, how it affects your life, and what your goals are, rather than going to the person who's closest to you, cheapest, or that suits your biases. Because people don't often admit out loud that they have biases towards trusting certain people over other, or if they're young and they have a thin body, they look fit, they're going to trust them more. But instead, ask yourself, like, who is actually going to be able to help you? A lot of the people I see have already seen another practitioner before they come to see me, and they don't realize how bad the other practitioner was until they see me, because until they actually get care that is supporting them. The other thing I wanted to say is, I'm so glad your mom and your family members now know about pelvic floor physiotherapy, or even just their pelvic floor, because Kegels have become popular. They're in all the magazines. But the other flip side of the coin is, most people do not need to be doing Kegels, and that's what people don't realize. We think that that is the exercise to help strengthen and tone our pelvic floor, but that would be like saying, in order to have strong biceps, you just have to flex them and relax 10 times a day, 100 times a day. We know that you actually need to lift, move, stretch, and the same thing happens with the pelvic floor. So a lot of people who just do Kegels all the time, their symptoms don't change. And they're wondering, am I not doing them correctly? Am I not doing enough? And then they blame themselves. When in reality, that probably just isn't enough to actually load your pelvic floor for someone, for example, with pelvic organ prolapse, which For most people who don't know what that is, it's just when one of your bladder, bowels, or your uterus, your cervix, everything kind of droops down into your vagina. Sometimes it can bulge entirely out of it. It's more common in people who've had kids. It's more common as we age, but it can happen at any age for people who've never had kids as well. And it can be symptomatic or it can be asymptomatic, where you don't feel anything for 10, 15 years. And then suddenly you start to experience symptoms when maybe you're suddenly very active or you've hit menopause and the hormones change. So, most people don't know what it is. Men, if you ask a regular male orthopedic physio, he would not know what that is.
What's pelvic floor?
Yeah, but many of them treat little old ladies who have prolapse, and they have no concept of what that is. So I went to a gym. I'm not going to name the gym. It's a very popular chain, but I was like, I want to do a talk on urinary incontinence, which impacts 1 in 3 women and 1 in 4 men at some point in their lives. Like it's very common. And they were like, ew. Like literally, they're like, people pee themselves during exercise? I'm like, yeah, like when they jump, they run. Yeah. It's quite common. And these are like typical young male gym bros that have that. But at the same time, that is who works in a lot of gyms. So
they also just don't get that knowledge and like fitness, any type of fitness background certification. They don't teach you that.
They don't. And they're not supposed to, because that's not their area of expertise. However, understand that when you're going to the gym expert for your trainer to get fit, and they might be pushing you to do exercises that cause pain, discomfort, or leakage, don't just trust them because they're an expert with a fit body. They're not an expert in your health, right? So that's where understanding like who to actually go for support is important. Most people go to their doctors, and their doctors are not orthopedic specialists or pelvic floor specialists. So they may mislead you and say, I've had people being told by their doctors, just drink some wine and you'll loosen up if you have pain with sex. Like actually, people are being told this. Can you imagine? Yeah. So that's why I'm very like passionate about women's health, because I want people to understand their bodies. I think if we all understood ourselves a bit better, then we would know when something's wrong earlier and kind of get that support. And then I also want women to know like they actually deserve to feel good in their bodies. Yeah. How many women who would say like, I feel amazing? Like everyone has got some complaint, and it's not their fault. There's a stereotype that women just like complain about everything. And I'm like, that's because things hurt. That's because periods hurt. That's because they're tired because nobody's listening to them. And then it's gotten so bad before they finally get support. Yeah. And people in their 20s ignore their issues. Then they get to their 30s and it gets louder, right? It gets worse. Then 40s, each
menopause
decade.
happens. Then menopause happens and it's all of a sudden even worse. Yeah.
Exactly.
Do you find that the hardest part about combating any stigmatization that exists around like pelvic floor therapy and even discussions around it, really forget the therapy sometimes, do you think it's largely, as you said, with people not seeking holistic care or not really being open to it? Or is there other things that you found to be more difficult when combating this stigmatization?
I think the biggest thing is actually culture and religion. Because people who have been raised in very religious, conservative households, regardless of the religion, tend to be very closed off to the idea of pelvic floor physiotherapy, even if they're symptomatic. But that's the beauty of like, I offer virtual physiotherapy. So I never have to put my hands on you, and we can discuss your symptoms, talk about exercises and strategies, and you can experience a huge change in your symptoms. So I feel like that's kind of like a way for people who are very sensitive or tentative about it, for them to access support without needing to lay down on a table spread open, right? And the other thing is culture plays a huge role. If you, like in my household, we couldn't utter the word sex. We couldn't utter, kissing scenes would be fast forwarded through. So if you grow up with a very like conservative background around anything to do with sexuality or pelvic areas, you're going to grow up thinking that there's something wrong or taboo or weird about it. And so when things go wrong, you're not going to know who to talk to about it, because the people who are closest to you are uncomfortable talking about it. And then you're like, ooh, my doctor? Like, I'm embarrassed.
A stranger,
and are they going to judge me? And when we start to look at the statistics of how common these issues are, like in, for example, Indian women, vaginismus, which is pain with intercourse, to the point where the muscles actually like spasm and clench shut, it can occur in up to 57% of women. That's like, we all know people who are Indian. Yeah. We all know people with vaginismus, whether they're talking about it or not. So I just find like really open conversations by courageous people. So like if you're the person in your friend group who's like ready to have these conversations, start talking about it and sharing, and you'll be surprised because other people will start to share too, because you just need one person to be more open about it, and it starts to kind of help people become more aware and open. And like that's why I started my podcast, because I was like, I just want to talk about these things. And how often do we see a brown woman openly talking about this stuff? Very uncommon, right? So I'm like, I feel comfortable doing it, and it's my area of expertise. And I hope that even if people don't feel comfortable seeking help, that they're able to understand their bodies better and maybe take and be empowered to make a change. If it's not today, maybe a year from now or 5 years from now, but at some point, right?
Absolutely. And I find educating, talking about makes such a difference. Like off the bat, people wouldn't think that physiotherapy is connected to public health, but when it comes to preventative treatment for postpartum or pregnancy-related health, it obviously provides a holistic approach to healthcare for women or people who are going through pregnancy. And through your business, your social media advocacy and everything, you're providing that education and the empowerment to women and like anybody who's going through these issues to obviously advocate for themselves, but also be understanding of the autonomy of their body.
100%.
Have you found, like, have you seen these positive changes yourself about seeing the topics and subjects being talked about openly? Have you seen changes? I know in fairly new, where I said you've only really started getting into this in the last like 6-7 years.
Yeah.
But in that time frame, have you found this openness and talking about has made a difference?
I think partly it is who you surround yourself with. So in some ways, I'm like, oh my gosh, everybody knows what pelvic floor physiotherapy is. Everybody I know is comfortable talking about these things. But it's totally not true. There are, and in Toronto, I live in Toronto, very big city. So there's more change here. If you go to any smaller town, if you go to, even within Toronto, there's a lot of people who have A, never heard of pelvic floor physiotherapy. B, they think it's only for pregnancy, postpartum, or only for women, or because men also have pelvic floors and they also leak and they also have constipation and all those issues. Or they think it's like for old people. Like there's an internal bias that like, that's not for me. Whereas everybody wants to go to sports physio. That's cool. That's trendy. Right?
Even if you don't do sports.
But even if you don't do sports, literally people would call me when I worked at the sports medicine clinic and they're like, I want to see a sports physio. I'm like, you literally do not exercise and have zero interest in it. That's weird. But they want to because they know that it's like a cool thing. Their athletes do it, so it's got to be fun, right? Like the cool jocks of high school do it. But pelvic floor physio, I think now influencers are picking up on it. And, you know, influencers have had babies, so now they're sharing about it on Instagram. So I think it's becoming a bit more trendy. But I noticed that people who know about it more, again, white women, it's marketed to white women as like a self-care, wellness piece. It needs to be marketed to brown women, black women, Asian women, Latino women, everybody else. And not just women, but men, non-binary people, everybody, right? Because I think
and creating a safe space also for having conversations that allow them to be apprehensive about it.
Yes.
I think that's so important. Like I think it's easy to say that, oh, like because they grew up in this household, it's silly for them to not think about it openly, but that's just their reality. And to like provide that patience and understanding of, okay, well, this has been the culture they've been brought up in, or this is the household. And it's not necessarily just people of color that's going through this. There's also,
lots of
white families
white
that
people,
have conservative, exactly. And I think
like
having
religious,
someone,
conservative Christians, like every religion, really. And the other thing is, I like to picture like the whole conversation around pelvic health, sexual health as a language. So if you have grown up in a household where you've spoken that language openly, you're going to be very comfortable in it by the time you're in your 20s, 30s, 40s, 50s. If you've never spoken that language once, and then suddenly someone's starting to talk about leakage and you're like, oh, I don't even understand what you're saying, or I feel uncomfortable. I don't get it. I don't think dominantly in this language. So I always say, like, give yourself time and I give my clients tons of time to like get comfortable with it. And I understand people have different ability or comfort levels. I've had clients who have told me after, I was really nervous before I saw you. I was like sweating. They had like a trauma response in the waiting room because they were so nervous. Maybe they've had a history of abuse or trauma. Maybe they're just really uncomfortable talking about this topic. But then they come see me and then they're like, you know, become calm. They feel better because I have experience in this field and I get it from both perspectives, both from being raised in an environment where it was very uncomfortable to then slowly kind of progressing through to not the other side, there's no other side, just improving my comfort with speaking this language, right? So
Yeah.
I totally get it. And I think it's very, very brave and courageous of anyone to decide to empower themselves and be like, yeah, I want this information. I want to know more. I've done workshops, just like online workshops, in-person workshops, talking about specific topics, women's health groups, for example, who just want to learn more, right? And they feel empowered just with that knowledge. And then maybe 6 months later, they're like, hey, I booked an appointment with you because I want to learn more. Yeah. And some people take that long. Some people take 3 years to get there. And so there's no perfect timing. It's just whenever you're ready.
Yeah, everyone learns languages at different paces.
Exactly.
Before we move on to talking more about this, we have this little segment on Public Health Insight called the Insight Blitz. And it's essentially we'll put you in a little bit of a hot seat and ask you some rapid fire questions. They're not hard. They're just questions to get to know you better. And it's just like brief responses, 4 or 5 questions, and first thing that comes to mind. So we'll start off. What's your favorite thing to do in your free time?
Dance.
Perfect. Me too. We know this already. And what's the worst piece of advice that you've heard as a pregnancy and postpartum coach?
Oh my God. There's so much. Avoid XYZ exercise because it's bad for you. So it could be avoid running because you have prolapse. Avoid sit-ups because now you have a diastasis recti, which is abdominal separation, which is 100% normal in pregnancy. So yeah, the avoid XYZ lists, avoid those. That's what you gotta avoid. Terrible advice.
So what would you say if someone had to avoid them? Is it better to find alternative rather than just avoiding something?
You can pretty much get back to anything that you want to do. It needs to be gradual. So if running causes you pain or leakage or whatever issues, there's hundreds of things you can do from now to there to get you there safely and with confidence. I never tell people, oh, you just can't run because you have this issue now. It would be very rare in only specific cases, but I can't think of a client I've told that to in the past few years. Earlier on in my career, I did practice like that because that's how I was taught in school. Oh, if it hurts, just don't do that activity. In hindsight, like, that is so stupid, really. Like, if that person's joy is dance and I'm just going to tell them, just don't do it if it hurts your knees. That makes no sense. But a lot of practitioners still practice like that because that's how often we were taught. And now especially after going through injuries and birth and being told not to run because of my prolapse, I found a different approach. So
it's clearly working well.
It is, yes.
Yeah. What is the most important skill in working as a pelvic and orthopedic physiotherapist?
Communication, like good listening and education skills, more so than any hands-on skills. I would say that.
What's a movie or TV show that you've watched recently that you would recommend?
Oh, God. Bridgerton.
Bridgerton season 3. That was good. I honestly really enjoyed it. I know a lot of people
liked all of them, and like Queen Charlotte too. Like,
yeah, that one was
right.
So sad.
Yeah.
So sad. And what's your favorite food?
I love Indian food. Like I could eat samosas every day. Dosa, idli dosa. I'm South Indian, so yeah, that would be my favorite.
I haven't had some good idli dosa in a hot minute.
I know. Me either.
There's not many good places in Toronto, to be honest.
Just my mom's. Come over.
Yeah. Done. All right. So that brings us to the end of that Insight Blitz segment. Great job. You passed.
Thanks.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight podcast is produced by PHI Media. Thank you for listening to the Public Health Insight podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.